purchasing the Probe One, a technological breakthrough that lets you harness the power of your computer for the diagnosis of periodontal disease. You will quickly discover that the Probe One not only gives you an easy, efficient way to accomplish your perio charting, and if desired, incorporate it into your overall electronic patient record system. You'll also find that it is a powerful patient education and motivational tool. Patient acceptance and follow-through of treatment plans will increase dramatically. This video is designed to assist you in setting up the Probe One hardware so it can interface with your computer and your perio charting software. It also provides a demonstration of Probe One in actual use with a patient. Let's start by taking a look at the Probe One components which came packaged with this instructional video. This is the interface unit. You'll note that it is equipped with 3 separate 9-pin serial ports, an input for the power supply, and an on-off switch. There are also 2 indicator lights, one red and one green, which will provide you with important information when the Probe One is in use. You'll notice we've clearly labeled all of the serial ports and the power supply input in order to simplify installation. The serial cable is a standard 9-pin serial cable which allows the interface unit to send the measured pocket depths to your computer charting program. If you need to extend the cable, an extension can be purchased at your local computer store. Some older computers may require a 9 to 23-pin serial adapter, which can be purchased from a computer store as well. The power supply allows the Probe One to be plugged into any standard 120-volt wall outlet. The foot pedal frees you to use both hands to conduct the exam. Pressing the foot pedal is equivalent to pressing the Enter key on a keyboard. This is the encoder handpiece. It's the permanent portion of the probe handpiece and is used in conjunction with a disposable probe tip. Each disposable probe tip comes in its own sterile packaging. Now that you're familiar with the various components of the Probe One, let's begin the setup process. Start by selecting a location near your computer where you can place the interface unit. Next, select an empty COM port on the back of your computer. Attach one end of your serial cable to the COM port and then attach the other end to the 9-pin serial port on the interface unit, the one labeled Computer. Now attach the power supply to the interface unit. Plug the other end into an electrical outlet. The next step is to connect the encoder handpiece to the interface serial port marked Handpiece. And finally, connect the foot pedal in the same way. Flip the on-off switch upward. The red light in the front of the interface unit will come on to show you that the Probe One is powered up. The red light will stay on until you turn the switch to the off position. Now that your Probe One hardware is fully connected and powered up, it's time to reboot your computer. The Probe One should be left on as the computer is starting back up. Once your computer is rebooted, you're ready to interface the probe with your software. Begin by launching your perio charting program. The Probe One interfaces with many different perio charting programs and many different practice management packages. In some cases, before your software will recognize the probe hardware, you'll have to make adjustments in the administration or the setup areas of your program. At this point, please refer to the user's manual that came with your perio charting software for instructions on how to configure your software to interface with your new hardware. Your perio software company's technical support staff can also assist you in this task. If you need to make changes in the administration of your software, make the changes and reboot your computer. Now that the Probe One is interfaced with your software, it's time to place one of the disposable tips on the encoder handpiece. Again, each tip is encased in a sterile package for infection control. Remove the tip from the package and place it over the shaft of the encoder handpiece. Push the tip into the handpiece until you hear an audible snap. If you don't hear this snap, the tip may not be properly engaged and the Probe One may not function properly. Remove and discard the protective tube or cap at the end of the probe tip. Now it's time to calibrate the probe. With a gloved finger, gently press the fiber filament all the way up into the white guide sleeve. With the fiber tip in this up position, tap the foot pedal and slowly release the fiber. The Probe One is now fully calibrated. Once again, note that the red light is always on. When the fiber is depressed and the pedal is depressed, the green light goes on and immediately goes off. This shows the pocket depth data has been transmitted to the computer. If the green light remains on, it usually means that the data is being sent, but for some reason is not being accepted by the computer. This usually indicates that the information is being sent from the probe to the wrong COM port. If this happens, turn the switch off and then on again to clear the interface unit. Go back to your computer's software administration and select a different COM port. If you make a change in the administration setup, you must reboot your computer. Please note, automatic probing systems are designed primarily for the early detection of periodontal disease. Therefore, it only measures pocket depths of 10 millimeters or less. The fiber extends up to 10 millimeters and reads in 1 millimeter increments. Measurements of 0.1 millimeter to 0.4 millimeters are rounded down to the nearest whole number. Measurements of 0.5 millimeter to 0.9 millimeter are rounded up. Now, let's listen to Dr. Brian Raskin of Valley Stream, New York, who explains the proper technique for performing a periodontal exam using the Probe One.
If you're trying the Probe One, or already have the Probe One, there are a number of things that you need to know to get used to using it. I've been using the Probe One in my office for over 2 years now, and it is a little bit technique sensitive and a little different than doing hand periodontal probing. The first thing that's very important is the calibration of the probe. You must remove the cover from the probe tip, and when you calibrate it, make sure that the filament is placed all the way in to the white cover. With the probe tip all the way in, you press the foot pedal, and that gives you your accurate calibration. If you don't push the probe tip all the way in, all of your numbers during probing will not be correct. Other things you need to remember about probing with the Probe One is that it gives you a routine, reproducible 20 grams of pressure on every probe. The advantage of doing that is that between each visit you probe, you're always probing with the same amount of pressure. So that if your hygienist probes a patient and then you probe a patient, there's no difference in the probe pressure and the pockets should be reproducible. This is different than hand probing with a metal probe, where the doctor's hand might be heavier than the hygienist or vice versa, and the numbers might not be accurate. Also, something very important to remember is that because the probe tip is flexible and it's only applying 20 grams of pressure, sometimes if a patient has deep calculus, deep tartar subgingivally in 3, 4, or 5 millimeter pockets, the tip might catch on the calculus. Often you need a little bit of tactile sense, and you need to wiggle the probe to work its way around the calculus. Often if I have a patient who I know has a lot of subgingival calculus, and I know that the probe is going to bottom out in a number of situations in their mouth, we get them in for at least a full mouth scaling before we do the periodontal probing. If we don't, and we do periodontal probe that patient, I inform them that after their mouth is cleaned up, we're going to go back and we're going to probe them again. And it's very possible that if they only had a 7 millimeter pocket, it might be 9, or a 3 might be a 5, because on the initial probing, the tip bottomed out on the calculus. The second time you go back in, after the patient is cleaned up, is the more accurate probing on a patient that has a lot of subgingival calculus. What I'd like to demonstrate now is going to the patient and showing how to place the probe into the sulcus and maneuvering it so that it slides properly alongside the tooth. If Lisa, you'll turn a little bit to the left, that's fine, and open for me. When you place the probe tip, you want to slide it within the sulcus and often wiggle the tip slightly until the white sheath is, again, touching the tissue. When you're sure that the probe is fully within the sulcus and the white sheath is touching the tissue, you then press the foot pedal.
2,
The sound of the pocket depths is then spoken by the computer. You then leave that pocket and move to the next site. Again, wiggling the tip slightly to make sure that you're fully seated within the pocket.
1,
You work your way around the mouth exactly the same way, feeling the tip insert into the pocket and the white sheath always touching the gingiva.
2,
It's more difficult if you try to walk the probe as you would a metal probe. I find that you need to actually take the tip out without walking around the sulcus and replacing it into the next spot.
1,
Once you get the hang of it, it moves pretty quickly. It's fully seated.
1,
Take it out. Again, fully seated and wiggle it if there's calculus.
1,
And work your way around the arch.
1,
After a week or two, you will notice that
1,
your speed will increase tremendously, and there's very little discomfort to the patient.
1,
I find there's actually less discomfort to the patient using the Probe One than with a metal
0.
probe because you're only applying 20 grams of pressure. There are a number of areas in the mouth that are a big advantage in using the Probe One, and I find that lower lingual is one of them because this is a very difficult area to see. Turn towards me again, Lisa, a little bit. Here, you can actually just place the tip, make sure it's seated, and press the pedal.
2,
And you don't have to read the lines off in the periodontal probe and see what the numbers and the depth are. Here we're probing the upper left quadrant, and sometimes it's also very difficult to see the distal or the upper second or third molar. But just by placing the tip within the sulcus, wiggling it, making sure it's seated all the way,
1,
and pushing the foot pedal, you get a very accurate reading of the pocket depth.
0, 2, 3, 0,
Always remember, especially interproximally, to make sure that tip is seated,
0,
to wiggle it. If you think
2,
that the pocket depths are deeper than what the probe is showing, you might want to pull the tip out and put it in a slightly different angle. Often that might work its way around the calculus and give you a more accurate reading. Sometimes you get a false reading when the probe tip is not placed within the pocket but is actually goes through the embrasure.
4,
In this situation, I have a good feeling that there isn't 4 millimeters of pocketing, there probably is less. I'm going to go back in and back up the computer and reprobe it.
2,
And here we have 2 millimeters of probing, which is much more accurate.
With the Probe One, it's very critical you do not rely on a tactile sense
1,
that you are accustomed to, but instead
1,
learn to depend on visual feedback of the white
2,
sleeve making
2,
contact with the gingival crest. Through eye, hand,
0,
and foot coordination, you'll learn to
1,
tap the pedal at the instant
1,
you see the contact made, and thereby you'll get an
0,
accurate result quickly and efficiently. If you do not use this visual approach, it's very likely that you will fail to obtain accurate measurements. As with anything else,
1,
there is a learning curve. Be sure to allow yourself enough time to practice the proper technique.
2,
If you do, you'll soon find yourself developing a smooth, continuous rhythm. Initially, you may get shallow readings in pockets that you know are actually much deeper. That's usually a sign that you're allowing the white sleeve to penetrate into the gingival pocket, thus creating an artificially shallow reading. On the other hand, if you're getting deep pocket readings that you know are relatively shallow, you may be pressing the foot pedal before the white sleeve has reached the gingival crest.